Hi everyone, it's Lucy from Medifine here. Hope everyone is doing well today. I spoke in my last video, I don't know if you got a chance to sort of view that, but it is available on our YouTube channel, where I was sort of using the MBK curve and I was using it to sort of help with that treatment on the neck. So looking at sort of tightening and specifically sort of helping with anti-aging around that neck area. I did speak on the video about how you can also use your MBK curve on specific areas of the body as well. So I wanted to sort of touch on that today with you. When we look at sort of skin on the body, it's a really good sort of tool to use on skin that might be slightly tired or flaccid, cellulite, if we get that sort of pockets of fat stores as well. Anything that you might feel that needs that little bit of extra support, strengthening, tightening around them areas. So we look at areas such as arms, legs, thighs, hips, buttocks. So there's quite a few, you can look at that décolletage and just above that breastbone to sort of help with that skin tightening and lifting. So it's a really good tool that can be used sort of all round, so we can use it face, neck and on the body as well. So I'm going to do a treatment today for you and show you how I would use this specifically on the arm area and concentrating on that sort of upper arm, that lower area here where it tends to be a little bit more needing that sort of tightening. So firstly, like with most of my treatments, I do tend to start with the Jane Man device, so her arm which is her sort of really nice massage tool. So with this one, I'm just going to be sort of combing that area. And again, I use this on the neck, so I did show how we would use that. But on the arm, again, it's just using the comb, and we call these two sort of the thumbs. So I'm combing down and then just putting that pressure at the end just with those thumbs. Now I spoke about pressure last time, so just when we're using this on the body, it can be a little bit more pressure can be applied than we would on the face. But again, not too hard that we're wanting to cause any sort of pain or discomfort. It really is just, again, a tool that's going to be sort of massaging, releasing that tension and that fascia in the skin. We're wanting to get that blood circulation flowing. So sort of a nice sort of middle sort of pressure, I would say, on the body. Now I tend to do this for sort of 3 to 5 minutes before my treatment, just sort of combing down. And there's so many different ways you can use this. So, I'm using the comb here, but you can flip this and you can use it with what they call the spine. You can use it there as well. It can make you go sort of a little bit pink and rosy, and that's, then you're using that perfect sort of pressure. As again, any pain or discomfort, or if you're going very red, then just take that pressure off slightly. I think this is just a nice tool just to prep for the next treatment. Release any tension that we may have in those arms. Okay, great. Now to use the MBK curve, firstly, I will apply so my gel, which I'm using today, which is the one that comes with the MBK curve, which is their body curve serum. And I always keep handy with me a mist as well. So this is the Isocell recovery solution that I'm going to keep handy with me today. In terms of sort of settings on the body with your MBK curve, as I mentioned, there's 4 different treatment options. And so we can use different sort of treatment modalities in different combinations, depending on what we're wanting to treat. It might be that also you do sort of one treatment. For example, if we combine LED and radio frequency, that's really nice sort of skin treatment for sort of skin rejuvenation. You might want to do that one evening and then switch it up and use, for example, the ultrasound with the vibration for another evening, which is more for sort of, we call it sort of the shape mode, the skin sort of tightening, support and structure. So there's lots of different combinations you can do with your MBK curve. Now, obviously, when you get the device, there's lots of information in there and a leaflet, so it's worth sort of giving that a read. But there is no sort of wrong or right, so you can sort of combine different ones depending what you're wanting to treat. So with my upper arms, I tend to find that this area specifically just needs a little bit more sort of strengthening with that in this specific area. So I will be using today, I'm going to be using the LED. I'm going to use it in combination with the radio frequency as well as the biomechanical vibration as well. So firstly, I will apply the serum. So even though we're on the body, obviously it does a little bit goes sort of a long way, but we do not wanting to go too thick in with the gel, but we want it to be sort of that nice thin layer so we can get that nice glide on the skin. And we're not wanting to massage it in too much because the device is going to do that for us essentially. Again, I'll just give it a spritz, and as I mentioned, I will keep this handy. So if there is, if the slip does go, we just reactivate that and give it a little bit more spritz. So we turn on the device here, okay, and then the options come up here. So this firstly comes up with the LED. Now I'm going to press the up button because I'm going to want that on the highest setting, which is level 3. I'm then going to press the on button one more time, which takes me to the CV setting, which this will give you a specific time. So this is your ultrasound setting. So I'm not going to use that one today, so I'm going to skip that. And then it goes straight to the, you can hear the vibration. It goes straight to the vibration on the RF. So all the settings do come up on the device so you can see which one you're using. And again, sorry, it did just actually go off there. So again, with the, so the LED, sorry, I'm gonna put that on this highest setting, and then with that RF, I'm gonna again put that on the highest setting to a 3. Okay, and then with, just gonna use my hair, then with the device, again, it's just keeping it in that sort of nice circular motions, concentrating on any specific area, working around that upper arm. And this one's going to be really working on strengthening that skin, the tissue within the skin. With the LED, it will be working on some of that skin rejuvenation as well. And again, as I say, you can decide which setting you prefer for specific areas. Recommending to do this twice a week, at least sort of once or twice a week. So when we look at sort of results, when we look at results, it's going to be that sort of continuous use for seeing those sort of long-term results on the skin, and that's going to go with the body as well. We have some clients that will use this twice a week, and they will do all areas in one go. So, you know, for each area, we would be looking at sort of 10 to 15 minutes to perform a treatment. Just going to re-spritz. So, so it would be sort of 10-15 minutes on this arm, 10-15 minutes on the next arm, and that would be your arms done. We have some clients that will then do the legs, again 10 minutes each side, for 10-15 minutes each side for the legs, move on to the stomach, go along that décolletage, and so you may, as all that time sort of that can add up. So it depends really on what sort of time you have. Other clients will work it where they have, they do sort of specific areas each night. So you might do your arms one night, and then the next night you concentrate on the legs, the next night you do your stomach, the next one you do your neck and face, the next one you do your décolletage, and then you rotate round and then you get back to your arms. And that way then you're looking at sort of 10-15 minutes a night, although with the arms and the legs, as you're doing both sides, it may be more like half an hour. But it just means that the time is a little bit more manageable for each area. But it's completely up to you as you do that. But what we would say is you don't want to do more than 2 times a week for an area. Now today I won't do the full 15 minutes because really the action is stays the same. So this was just to give you an idea of how specifically I use my MBK curve on the body to give you an idea. So it just gives you an idea of how you would do that. But again, nice circular motions, working in specific areas, but also, you know, going around and supporting on other areas that you know is going to help with that structure support around. So there's a lot more information on our website about this device. There are a few contraindications: pregnancy, breastfeeding, metal plates, but they are all listed on the website. But if you do have anything specific, obviously just email us or give us a call and we'll be able to help with that as well. And again, if you do have the device and you're unsure which setting to use, we can put together some program options for you as well. Okay. So to turn the device off, if you do it before the time, you just hold that button, the on and off button, just hold it, keep it pressed down for a few seconds, and that will then turn on. And then cleaning the device, I will take this and then give it a clean, and I will leave on my my body serum. I'll just leave that on, and that is the treatment done for the arms. So again, you would be choosing that specific area and choosing your sort of setting and doing that for sort of 10-15 minutes every evening. I hope you found this video useful, but if you do have any further questions, please just do let us know. Thank you.